Bismillahirrahmanirrahim. So today is 16th January 2022 and we have finished the Vipcross course. That was excellent course. But what I would say, this course should be at least 2-3 months before the actual date of exam, so that you can have enough time to go through the things which they tell you during the exam. But unfortunately, my exam is on 2nd of February in Glasgow, and I'm living in South Yorkshire. So obviously, I need 1 day traveling. So in other words, on 1st of February, I will travel. So anyhow, and I also been to my country in Pakistan in December for a whole month, and that was, I think, it was bad planning. But anyhow, nature plans well for you. Let's go for it. So I have decided today that the hot book for this exam is Cracking the Intercollegiate General Surgery FRCS Viva book, which I have gone through almost 70 to 80%. And now I want to revise it again after having this course. And I think this is the only book which contains most of the content for the exam. And during these 7 days, that was very, very exhaustive and tiring, because we used to start at 9 and finish at 8. It's about 11 hours teaching every day with the little breaks in between. But anyhow, let's move forward. So I have gone through this chapter, Academic Viva, and I just want to summarize it for myself, and so that I can if I want to revise this chapter, I can go through this short video clip. Okay, so let's start with the first topic. So Academic Viva, first chapter, the first topic is how to review a paper. And believe me, during my whole life, I only presented one paper as SHO when I was in Waterford University Hospital in 2015, and since then I never presented a paper. And it was because this is a skill just like a history taking. It comes with the practice, and you can't learn this practice from the books. But anyhow, what I have summarized or I have kept in my head from this book, that first of all you have to read the title of the paper, and you should just like say it like a parrot. It should be very objective, very to the point. Yeah, title of the paper, name of the journal, date of publication, and quickly about the country or the center from where this research was conducted. Yeah, and then you should go straight to the introduction. So introduction includes a short abstract, and then in the introduction you have to see what was the. So in the abstract, you should see whether this abstract is relevant with the paper. So you can't comment until you read the whole paper. So you should tell about the abstract. Then you should go to introduction, where the background of the study has been mentioned. It's their clinical importance. And in the introduction, also we should tell about what was their question of the study. Either it's a new knowledge by research, or they did this study just to make a clarity in an ongoing uncertainty. And then is the method. So in method, we have to read, either have the given any inclusion criteria, exclusion criteria, any selection bias, or are there during the method we also mentioned that how they have what type of study it is, and what is the power of the study, how they calculated the power, and what are their endpoint, the study points, what are their primary outcome, what are their secondary outcomes. Yeah, and so this is a brief methodology. Yeah, so we talk about introduction, methodology, and then the examiner, while during this course, they were keen to know the title, and then they were keen what was the question, and a very brief description about the methods, and then they were very keen to know about the results. So results and discussion is the main part of your academic paper presentation. Okay, so in the results, so first of all we have to see that you should, while reading the paper, you should go through all the tables, all the graphs, because they are easy to interpret, quick to interpret, than to go through the whole lot of paragraphs. So in the results, all the results are set out, what statistical analysis they have done. Like my paper was a synchronous chemoradiotherapy, which is now TNT, and their objective endpoint was survival outcome, and the graph they used is a Kaplan-Meier curve, and I wasn't aware of what is Kaplan-Meier curve, which I came to know after presenting that paper. So you have to go through the results, statistical analysis, appropriate or needed, are all the patients accounted for, what is the type 1, type 2 error, and then what's sensitivity, specificity, can you explain the forest plot, rock curve. So these are the things which we have to tell them. And have the results been presented in a biased way, and is there any follow-up adequate, and what complications they have mentioned. And in the discussion, we should tell them that are the results discussed fairly and compared to the current literature or any past literature, and what are the novel or new observations, and is the topic is covering the existing guidelines or published papers, and are the conclusions supported by the data presented, and what are the healthcare issues. And in the final summary, they will ask, do you think this paper is going to change your practice? Is the generosity of this study can be applied in the practice? So you have to decide after reading at the conclusion of the study, and you can give this at the beginning of and depending on the examining style, and summarize in 5 to 6 sentences, pick out the good and bad points. Oh yes, also the merits and advantages and disadvantages of each study, and make an opinion that is a good, average, or bad. And if they might ask how you can improve this study, and if you were the editor, would you publish it? So this is just the first topic, how to review a paper. Thank you.